Hi everyone, it's March 5th, 2026 and welcome to the monthly Dr. Fox live Q&A where I answer all of your health questions live. I'm just going to quickly check that everything's working and looking right. Perfect. My name is Abraham. I'm an advanced clinical practitioner and pharmacist and the lead of the YouTube channel here at Dr. Fox, an online doctor and pharmacy where we create science-backed content focused on your health and well-being. We go live every first Thursday of the month, so mark it in your calendars. We're going to dive into your questions. I'm just going to quickly make sure that everything's looking smooth on the channel. Yeah, and the chat's perfect. So just a bit of housekeeping before we begin. All the questions I answer here are submitted by viewers like yourself through the comments on our videos and social media. So if you ever have a health question, just drop a comment and I'll try and include it in this live session if you do comment whilst I'm live. Or if you comment after it's gone live or on any of our other videos, we will note that question. I'll answer it in next month's episode. So every first Thursday of the month, we have a live show on the channel. And of course, we have daily health videos as well. Perfect. So without further ado, we're going to begin. We have a comment from Storm Force Becker. And this is from our video on how to delay your period. The comment is, how can this be done for someone who is on HRT? I am on high estrogen, high progesterone, and still my period is coming 10 days after a previous bleed stopped. A 10-day period, exclamation mark. So that's a great question, and it's an important one as well. So when someone is using HRT, sorry, I'm just checking something. So when someone's using HRT, especially combined estrogen and progesterone, we don't apply the same period delay principles as we do for contraception, because in the video we actually discuss using certain contraception, combined oral contraceptives to help delay your period. HRT it isn't designed to suppress ovulation or stabilize the uterine lining in the same predictable way that the contraceptive pill does. So if you are on high estrogen and high progesterone, and you're still bleeding or bleeding again only for 10 days after a period of stop, that's a sign that HRT regime, it might not be giving you enough lining protection or that the balance between the hormone isn't quite right for your body. So unscheduled bleeding on HRT is actually very common, but it always needs assessing properly by your medical provider, because sometimes it's as simple as adjusting the progesterone dose or changing the type of progesterone, or switching from sequential to continuous HRT if it's appropriate, or changing the delivery method, for example, to patches, to gel, to capsules, to intrauterine systems. So the key thing here is that HRT is not a reliable tool for deliberately delaying or controlling periods. That's the most important thing to remember. If bleeding is happening this frequently or is lasting this long, it needs a proper review. So to check that the regimen is safe and appropriate and to rule out any other causes. So the safest next step is to speak to your doctor, your medical provider, your HRT prescriber, to review your current treatment, your bleeding patterns, and whether your hormone balance needs adjusting. On the Dr. Fox channel, we focus on licensed contraception options for delaying, but for anyone on HRT, it must be handled individually by a clinician who can look at your full history. All right, great. So we're doing good. I will continue on to the next comment. So the next comment is from James the Build. Is oral minoxidil better than the topical solution? How do you know which one to use? This is from one of our hair loss videos. And when patients ask me about oral minoxidil, if it's better than topical, there's one important point to understand. So topical minoxidil, like the solution, like the foam that's applied topically, this is licensed. So it's well-studied treatment for male and female baldness or hair loss. Oral minoxidil tablets, they're not licensed for hair loss. So topical works locally on the scalp. So it widens blood vessels, it opens potassium channels, and it helps stimulate follicles by extending the anagen, the growing phase of the follicle. And used consistently, so sometimes twice a day, sometimes once a day, depending on your treatment, it can take around 6 months for you to see meaningful improvements. Now, a lot of people then ask, well, is oral minoxidil stronger? Is it better? And clinically, the answer is no. Oral minoxidil, it can actually cause a lot more side effects because the dose affects the entire body. We're no longer using it topically on a certain area. So it's not just using it on the scalp, we're taking it orally. So it's going to affect the entire body. So this includes things like fluid retention, changes in blood pressure, an increase in hair growth in unwanted areas as well. And importantly, oral minoxidil hasn't been shown to work better than topical minoxidil for hair loss. So that's an important fact that I want everyone to remember. Just checking on the page. So topical remains the preferred evidence-supported option, and oral minoxidil is only ever considered in specific cases with close clinician supervision because it's unlicensed and basically carries more risk. So topical first, oral only with medical oversight, and neither one works overnight. Consistency is key, and that's the thing that I'm always telling my own patients. You've got to be consistent with treatment for it to work. The other thing as well to bear in mind, this is one thing that I always mention in our videos, is about scalp massaging. So trying to do a scalp massage every single day, at least 4 minutes a day, that's just going to help boost blood circulation. And when you're doing that scalp massage, you really want to, if you imagine this is the scalp, we're not just doing this, we are genuinely trying to move the skin over the actual skull, back and forth to get that blood flowing. We do have videos on the channel explaining how to do a scalp massage properly, by the way, as well. But the whole point of getting that blood flowing is we're going to get more blood flow to the follicles, which is a yes, but also topical treatments like minoxidil, like finasteride solution as well. If you do a scalp massage before using it, we can increase the absorption and hopefully make it more effective. So if you haven't watched our videos on that, definitely give it a watch after, because it's one of the things that I always discuss, and you won't hear about the scalp massage anywhere else. This is something that I've been telling patients for years, and I found it very effective. Okay, I have two tabs open, by the way, so I'm just gonna flick over back and forth just to make sure that I'm not missing any comments. Okay, so we'll just carry on. Next comment is from Healthy JJ. Comment is, why do I get bloated even when I eat healthy foods? I'm so confused because I'm eating clean, but still look 6 months pregnant by the evening. So Healthy JJ, this is incredibly common. And it's one of the biggest misunderstandings in gut health, really. So healthy foods aren't always easy foods. So that's the best way to remember it. Many nutrient-dense foods like beans, lentil, broccoli, cauliflower, onions, garlic, even apples and oats, they're what we call high in fermentable carbohydrates. And these feed your gut bacteria, which is good for long-term health, 100%. But in the short term, they can create a lot of gas. And gas, unfortunately, causes that bloating. You just need to think of it like a closed balloon. So it's going to cause that bloating. You can also react to how much fiber you're eating as well and how quickly you introduced it. If fiber goes up suddenly, like really rapidly, your gut can feel a bit overwhelmed, even though the food itself is healthy. So portion size matters too. That's another thing as well to be aware of. A huge bowl of healthy food can really stretch the stomach and create pressure that feels exactly like bloating. And many people unknowingly have food triggers as well. This is a very common thing that I see in practice with my own patients, like lactose, like wheat, like artificial sweeteners, or even protein shakes, all of which can cause bloating, even in someone eating really, really well. So I guess the message is bloating doesn't mean your food is bad. It means your gut isn't tolerating the amount, the timing, or the type of fiber and fermentables you're giving it. A food diary is something I always recommend to my own patients, and we discuss it in our own channel videos as well. Do go and watch our videos on bloating. If anyone's watching this, we go through it in a lot of detail on what you can do and what's helpful. But I always recommend, we've all got a phone, start using your phone to basically write down what you're eating, write down when you're eating it, write down your symptoms, and if you're having something unusual on that day, write it all down. And then you can sort of look at it over the week. And, you might be able to find a correlation if you're feeling bloated later on and you're like, hey, actually, every time I have cauliflower, for example, I'm actually seeing this spike in bloating a few hours after it. And then you can try and think, okay, well, maybe I'll try and remove that and see if it helps. But obviously, do not remove an entire food group without speaking to your medical provider. That's really important that you always discuss it with them. Perfect. I'm just going to quickly go to the chat. We're looking good. Everything's looking clear. So next question that we are going on to is from Quiet BRB. This is erectile dysfunction related. So why can I get an erection on my own, but not during sexual intercourse? It's really stressing me out. That's a very good question. And it's a very common one that I hear, actually. It's probably the single most common ED pattern I see, honestly, in practice and in clinic. If you can get an erection on your own, that it's no problem. But when there's no pressure, it's usually easier. But sometimes it collapses during sexual intercourse, and that's almost always, for me, that would point to something like performance anxiety, not a physical problem. So I hope you see where my mind's going with that. And here's why. So an erection depends on the parasympathetic system, your rest and relax mode. Sexual intercourse with a partner often activates the opposite system, so fight or flight. Okay, I'm sure you've all heard of that. And the moment you're stressed, overthinking, or you're worried about whether you're going to have a problem, you're going to have some erectile dysfunction issues, adrenaline increases, blood vessels tighten, and the erection fades. And it's not psychological weakness, by the way, for anyone watching. It's a normal psychological response to stress, to pressure, to expectations. So this pattern is especially common in younger men and in anyone who feels pressure to perform. The good news is that erectile dysfunction in this situation is usually highly treatable, reducing performance pressure, breaking the fear to failure cycle, and in some cases, using medication temporarily can actually help rebuild confidence as well. Until that stress response settles. But of course, it's always a good idea to speak to your medical provider about this. But a few safety points: if you're not getting morning erections, if erections are weak, if you have diabetes, if you have high blood pressure, if you have high cholesterol, or if erectile dysfunction comes on suddenly and persistently, that's really when you should speak to a clinician. Those patterns can signal a physical or cardiovascular cause that needs assessing properly. But when erections are normal alone and only unreliable when you're with a partner, that's one of the clearest signs to me, like I said at the start, that the physical mechanism is working. It's more of a stress response. And honestly, one of the best steps for that always is to speak to your partner, let them know what's going on. And that can actually be very calming and reassuring, because most partners will be very supportive, and that support is what you need just to calm down that stress signal. Perfect. I'm just flicking over. Like I said, I've got two tabs open, so if you've left a comment, I will come to you, but we're looking clear at the moment. So I'm just going to move swiftly onto our next comment. So next comment is a comment on sildenafil, also known as Viagra. That's the brand name, and it's from Mr. Stedman, UK. Can sildenafil stop working over time? What should I do if it becomes less effective than before? That is a very common question. Thank you very much for that. That I hear from patients all the time, who are usually asking for a higher dose. So sildenafil doesn't usually wear off. That's the first thing that I want to tell everyone. But there's a few reasons why it can feel less effective over time. So first, underlying health changes, kind of like what I spoke about earlier. So blood pressure, cholesterol, diabetes, weight gain, smoking, or even sleep disturbances, stress, they all affect blood flow to the penis. And if circulation gets worse, sildenafil has more work to do, pretty much. Secondly, the timing and technique matter. So a high-fat meal, alcohol intake, or taking it too early or too late, the sildenafil can blunt the effect. And that's one of the most common reasons people think it stops working. We actually have a video that went live, I think it was this Monday, talking about the mistakes that I commonly see with patients who take sildenafil. Those are some of them, but I go through a lot of detail on that video. So if you are taking sildenafil that's been prescribed for you, definitely watch that video, because I give a lot of handy tips that are useful to know. So I've told you two things so far. Let's move on to the third thing, the dose. So some men start on 25 milligrams or 50 milligrams, but that's entirely up to your medical provider in terms of what they recommend to begin with. And the fourth thing I also want to discuss is expectations. So sildenafil doesn't create an erection on its own, and that's really important to remember. And that's what I always discuss with my own patients in clinic, is that, and it's also a bit of a false, expectation that a lot of patients have and they're concerned about, is actually, oh, if I take the sildenafil, How long will this erection last? Because obviously I need to do my own daily activities, which is completely understandable. But you need to remember that with sildenafil or any PDE5 inhibitor, any medication like that, you still need stimulation. So you still need that stimulation and relaxation. And if anxiety increases, the medication may feel weaker as well. And finally, if you've used sildenafil for a long time without addressing blood pressure, cholesterol, weight, relationship stress, you might be treating the symptoms while the underlying cause is slowly worsening. And that's how a clinician thinks, really. So if your sildenafil feels less effective, if it's, it's not usually the medicine, it's your health, it's timing, it's dose or stress levels that's changed. So a proper review with a clinician is usually the most important thing that's going to help solve it. Perfect. We are doing good for time. I'm just going to flick straight on to the next question. We're looking clear on our comments. So the next comment is from Luna Bloom 87. Why does my yeast infection keep coming back even after treatment? Okay, wonderful. So it's one of the most common questions I get. This actually is a very common one I get from many patients. So yeast infection is commonly what it's called in America. In the UK, we call it thrush. And it can be incredibly frustrating, right, when it happens. So let's break down why recurrent thrush happens and what clinicians actually look for. So first of all, when thrush keeps returning, it's almost never because the treatment didn't work. It's usually because something underneath is creating the perfect environment for yeast to grow again. So I'm going to go through the main causes. So firstly, antibiotics. So anytime you take antibiotics, they don't usually just kill the bacteria causing an infection. They also reduce protective bacteria, which we all have. So this protective bacteria can be in the vagina, for example, that normally keeps yeast under control. And when those protective bacteria drop because of the antibiotics, yeast can basically take over. It can overgrow again, even if you've just treated a previous infection. So that's a really common trigger, and it's probably the top trigger for repeated thrush. The second thing is moisture, heat, and friction. So yeast thrives in warm, moist environments. So things like tight gym leggings, synthetic underwear, panty liners that are worn daily, not changing out sweaty clothes, sleeping in underwear, synthetic underwear in particular, by the way, they all increase heat and moisture and create ideal growth conditions. And this alone can trigger recurrent infections, even when the immune system is perfectly healthy. The next thing I want to discuss is blood sugar. This was often missed. High blood sugar feeds yeast and weakens the local immune system. So recurrent thrush can sometimes be one of the earliest signs of insulin resistance or undiagnosed diabetes. So if someone gets thrush repeatedly, despite doing everything right, clinicians will often check blood sugar to rule this out. Another thing as well is sexual activity and irritation. So it's important to remember that thrush yeast infections, they're not an STI, but sexual intercourse can trigger flare-ups. Friction, lubricants, condoms, even semen pH can distribute vaginal microbiome and make the area more vulnerable. So if skin is already irritated, yeast takes advantage, but partners don't usually need treatment unless they have symptoms. So that's an important one to remember. And the next fifth and final one is misdiagnosis, because it's not always thrush. And this is a big one I actually see quite commonly in clinic. Repeated thrush doesn't fully respond, when it is, for example, bacterial vaginosis, dermatitis or irritation, lactobacillus overgrowth, vaginal atrophy, STIs. So when symptoms keep coming back, a swab really is essential to find out what's actually causing it, because treating the wrong condition can make everything worse. So it's really important that if you are having repeated thrush, yeast infections, that you get medical advice. You speak to your medical provider so they can find out why it keeps happening. Perfect. So looks like we've done for today's live show. Thank you so much for everyone for tuning in. This month's Dr. Fox live YouTube Q&A. If you're watching this video after it's gone live, don't worry, we have a new episode every first Thursday of the month that you can click for notifications for when it goes live to join us. So if you have any questions related to your health, anything about hair loss, anything about erectile dysfunction, anything health related, come and join us, ask your question. I'll do my best to answer it in that episode. If I don't have time in that episode, we'll answer it in next month's episode. So definitely subscribe to our channel to stay up to date with our daily health videos. We post videos every single day on various different health topics. And as we always say, thank you so much for watching. Always remember, Dr. Fox, discreet care delivered direct to your door. Have a great day.